I'm Combat Craig, and today we're talking about the VA withholding medical evidence and how you can fight back. In order to establish service connection, you need 3 elements: diagnosis, symptoms, and a nexus. Today we're going to focus on the diagnosis because it's actually harder to spot than you may think. If you're interested in learning how to put yourself in the best position to level up your VA claim, I'd sign up for my boot camp at combatcraig.com. Get in there. So how can the Department of Veterans Affairs treat you for a disability and not give you a diagnosis? Seems ludicrous, right? This is a good question, and the answer is the VA's the enemy, and they can do whatever they want. You have to review your medical records to make sure you have a diagnosis. It's going to look differently in your records than it is for mine, but you need to make sure that you find it in there because that is one element of service connection. You have to have a diagnosis. You can have something that will be almost like a diagnosis, or will this work good enough for a diagnosis? It needs to be a diagnosis. So you do that by reviewing your medical records. And I'm going to walk you through my medical records and show you where I finally found my diagnosis of combat PTSD, what I did to actually clean it up and make it real clear, because it still wasn't clear to me. So I went out and got a private doctor to clarify things up. So I have my little blue mouse thing here so you can see it. This first snippet is from 2005. So screen for PTSD. This is 2005. What's 17 years ago or something like that? And, you know, do you have nightmares? Yes, yes, yes. Like, yes to all these. Extremely bad. PTSD score 60. Patient meets criteria for PTSD. Referred to MD. I don't even remember this. This is in 2005. But this is an example of not a diagnosis. There's mentions. They're saying that I meet the criteria, but this is not a diagnosis. Fast forward to 2015. Here is a C&P exam for mental health that I had. So we have, these are the notes from the C&P examiner. So exit exam dated 8/91, unremarkable for mental health issues. Yeah, no shit. You don't talk about mental health issues. I don't even think PTSD was a thing in 1991, but this is one of the things they're going to put in your records to deny you. You know, health record dated 6/23/89, cleared for deployment to Panama. So he was healthy as a horse there. Entrance exam, 11/24/87, unremarkable for mental health issues. So they're going to go through and find the places where, well, no mental health issues when he, got in, and he was cleared for a deployment, and he was fine then. And then when he got out, he was fine. Everything's fine. He's been on medications for anxiety and depression, and he also states that he hasn't been right since Desert Storm. I made a video a couple days ago about how the VA will quote you. I haven't been right since Desert Storm. So watch what you say to all VA doctors, VHA doctors, VBA, C&P examiners, all of them, because they write all this stuff down and they quote you. So it's just kind of funny. There's no problems. But then the war started and he went downhill real quick and we kicked him out. So they highlight that, but that wasn't used in my favor. I was able to do that afterwards a couple years ago and get that fixed. And then here's the evidence they were using. There's a screen for alcohol and depression and PTSD in 2005. 2008, did some other stuff, nursing notes. I was saying stuff, I just didn't know how to say it, and I needed to get a diagnosis is the point I'm trying to say here. I could have had this claim won and established in either 2005 or 2008, but I didn't get combat PTSD established until 2019. So then they kind of repeated stuff, and this is what they write. The claim condition was less likely than not, less than a 50% probability, incurred in or caused by the claimed injury, event, or illness. And then they provide rationale. So when it's less likely than not, that means your claim's tanked. So now in 2019, I'm looking through my records. I see there's PTSD right there. There's a SCT code, mood disorders, on my problem list. And this is the first time that I see a diagnosis. It's not a big glaring unicorn, but it's in here. Diagnosis, primary, focus of treatment, insomnia, secondary, if applicable, PTSD. So I'm kind of looking at that going, that's kind of a diagnosis. It'd be nice to see more, so keep scrolling through your records, VHA records, private records. Here's my past medical history. There's no mentions of PTSD here at all. They're very clever about keeping your diagnosis out of things you're going to file a claim for. So here's some notes from the VA psychiatrist. She did diagnose me with PTSD, and then she says, will increase the dose of duloxetine to 30 milligrams for further relief of PTSD. So there's a diagnosis of PTSD and then prescribing meds for further relief of PTSD. So those two things are looking pretty good. They're looking like a diagnosis to me, but I'm not a doctor and stuff. And we're talking about opioid use and Adderall, and they don't like Adderall. They don't like Xanax, and it's causing mood instability, but he's not willing to get off of it, but I was getting off of the Norco. I'm not sure the bupropion helps, which is Wellbutrin. Will increase the dose for further relief of PTSD. Reports of numbness on his left hand. I never reported numbness on my left hand because it's on my right hand. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website. And in the description, combatcraig.com. And also, if you need medical evidence, like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.